these sessions that we at Sedgwick are putting on and basically labeling it as our Virtual RIMS Week. For this session, Dr. Teresa Bartlett and I are going to discuss medical marijuana, hazy health, and cloudy compliance. Now, if that isn't enough about the weather and its relation to marijuana, I do not know what is. But as we go into that, the first thing I'd like to do is just ask Dr. Bartlett to introduce herself, and then I'll introduce myself and my role with Sedgwick. Dr. Bartlett?
Sure, thank you. Well, hello, everyone. Welcome to Virtual RIMS Week at Sedgwick. My name is Teresa Bartlett. I am the Senior Medical Officer at Sedgwick, and I'm really happy to be here with you virtually. Hope we're all staying safe, washing our hands, covering our face, and avoiding the COVID virus. But in the meantime, we'd love to share with you about marijuana because, you know, why not? We all want to know about it.
Thank you, Dr. Bartlett. And I'm Max Koonce. I am the Chief Claims Officer for our Casualty Division with Sedgwick. So just to start off our discussion this afternoon, the first thing I'd like to do is just talk about the current environment surrounding marijuana in general and also with regard to medical marijuana. In 1996, California became the first state to actually legalize medical marijuana. Since that time, we've had an additional 33 states, plus Guam, Puerto Rico, and the District of Columbia, that have also legalized marijuana from the standpoint of medical use. In 2012, Colorado and Washington became the first states to legalize marijuana from a recreational standpoint. Since that time, we have a total now of 10 states and the District of Columbia that actually have legalized the recreational use of marijuana. Marijuana is no longer just a medical issue. It's something that we face in a lot of different avenues in our lives, because of the fact that it is being used to a greater degree, at least legally, than it was in the past. We've had a number of states that are actually going the route first of kind of what I would call decriminalizing the use of marijuana. They're making it going from a felony down to a misdemeanor and actually equating it nearly to a traffic stop. So there is an overall push across the country to allow a greater use of marijuana in some form or fashion in a legal standpoint. What I'd like to also just point out is the market. For 2019, I saw one study that projected that the market by the end of 2019 would be $19 billion in legal retail sales of marijuana and cannabis-related products. From a world market standpoint, they're anticipating that it will be a $60 billion to $140 billion, pretty wide variance there, across the world by the year 2025. So I only bring that up before we get into the details of our discussion to just basically say marijuana is here to stay for the time being. It's something that we're going to have to come to grips with, not only in the employment environment, but also in the way that we approach workers' compensation. The next point in our discussion that I'd like to reference is just to ask Dr. Bartlett to really talk about the science behind marijuana and its usage as far as the impact on individuals and how it influences things going on as far as with an individual. Dr. Bartlett?
Sure, thanks. You know, Max, just to point out a couple other things, there's 183 million people worldwide that use marijuana, some form or fashion. And about 20% of those are in the USA. And we know, to your point on the billions of dollars, we know that it's actually becoming a vertical as well in the insurance markets and around the globe because, you know, there's growers, there's transporters, there's retail. So this is something that we've really been keeping our eye on and watching for the past several years. So there are 2,400 different strains of marijuana. That's a lot. The primary two forms of it are indica and sativa. So I'll give you a little hints on how to remember those. Sativa is a high energy high. So if you take the strain that has sativa in it, you might want to go out running. You might have a great workout at the gym. You might have a lot of energy to get through your day. The indica, otherwise known as indicouch, is the one that relaxes you and makes you feel like you could sleep. And so a lot of people that use marijuana will use this one at night. Now, it affects the body in multiple ways. And it's important to know, and we're just on the infancy of studying this, but the pharmacology here is that we have CB receptors, cannabidiol CB receptors throughout our body. We have the CB1 receptors and the CB2. Now, there are 16 others, and we really are just discovering that they exist throughout the body. But the CB1 receptor is the one that THC binds to, and it is in the brain. And it controls your mood, your thinking, your emotion, your pain, your memories, your appetite, and muscle coordination and movement. So that is why the CB1 is so important to understand. The CB2 receptors, though, are found throughout our whole body in our immune system. And they're found to induce macrophages, which will eat away infection. And they're studying this right now because it's thought that if we can stimulate the CB2 receptors, that we can reduce the beta amyloid plaque that is found in Alzheimer's disease. Still a long way out in any of these trying to determine if there's value there. But what we know is that THC binds to the CB1, which is in the brain, and cannabidiol, which is the non-psychoactive effect, doesn't bind to any receptors, but it stimulates them, which is an important distinction. So now I just want to talk for a minute about how marijuana affects the users. So if it is smoked or vaped, the effects of it are felt within seconds. The high associated with it lasts 2 to 3 hours, and the peak of that high is in general at 30 minutes. What it does to the body is it causes slowing of reflexes and response time. It causes a dreamlike state, such as a slowing of time, kind of a morph state. It does cause an increased heart rate, though, and depending on the dosage, causes anxiety and panic. So when you think about that from an emergency room perspective, we see plenty of patients going to the ER thinking that they're having a heart attack, and they're in a state of panic, and it's associated with using marijuana. Typically, those types of cases are not a single-use type, but more so the chronic users who use all the time. We also are seeing in the ERs these days, well, not these days, but cannabinoid hyperemesis. And what that is we're seeing young people come to the ER with profuse vomiting. They can't stop themselves. And it's associated with an overdose of marijuana. And the only way to break free of that is to pop them in a hot shower. And that causes your symptoms to, or the dilation of vessels, and for you to come out of that state. It also causes disorganized thoughts. And the latest research is saying that there's a population of individuals who actually, from one use, can develop psychosis and schizophrenia, which we're unsure right now if it can be reversed, which is completely scary when you think about what could happen in these cases. I think it's also important to note that marijuana has all of these side effects. There's a lot of people out there that are touting all the health benefits. And I would say, yeah, there may be some, and I truly hope there are some, but as of yet, a lot of the things that are touted out there are not really studies. They're surveys of people who use. But so, for example, we have research that's done that says it'll help chronic pain. And what we know is THC in very high doses will help with chronic pain, but the side effects of the anxiety and the depression that follows may not be worth that effort. We have a study going on right now to determine if it can help with alcohol or opioid dependence. And there was something published actually in 2018 from the Clinical Journal of Psychology. And honestly, the journal article is being widely disputed because there isn't really the evidence out there that can be studied. So we know it helps with cancer-related nausea and vomiting. We know it improves spasticity a little bit in people that have multiple sclerosis, and even individuals that have ALS, the Lou Gehrig's disease. It can help with the spasticity in their voice. So it is important to watch the research. It's just we don't know at this moment what we're going to find. There's still so much out there that is unclear. So Max, I'm turning it back to you.
Yeah, thank you, Dr. Bartlett, and I'm going to flip it back to you real quickly. Just because having talked about just kind of the impact that it has and, you know, the science behind it as far as it's what it does to us, it's obviously coming into the workers' compensation environment. It's been legalized in the vast majority of the states from a medical standpoint as far as its uses. So how does that relate into the way that we manage the claims in our environment as far as the treatment and the usage and the review of it and so forth?
Oh, good question. Well, I think it's really important that we have our finger on the pulse. We absolutely understand what is happening in all the various states. And we're seeing physicians more and more using this as either because a patient asks them for it or because they're fed up and they have nothing else to try and they're very frustrated. So we're starting to see, I would say about 1.5 years, 2 years ago, we started to see more and more prescriptions coming in the workers' comp environment. We have a team actually that culls all the clinical research around the world and gathers all this data, because if there's something beneficial, we want to be on that foreground, and if there's something detrimental, we also want to call that out. We are concerned about the health and safety of the injured workers. So what we have in place internally at Sedgwick is a process called a marijuana review process, where examiners get a request for marijuana, and then we actually will take that, do a whole history of the claim file, a chronology of everything that has happened since the injury, how many surgeries, what kind of treatment, if there's been physical therapy, what kind of medication. And then what we do is we compare that patient, their comorbidities, all of their health risks and their status with what we know in the clinical literature. And I think it's important to mention this, that we know that medical marijuana is associated with testicular cancer. It is associated with psychosis, as we talked about. We've seen now, since Canada is over 1 year legalized for recreational use, we've seen an increase in stroke and heart attacks. And the reason is, as we talked about, the CB receptors, There are CB receptors specific to the heart, and the marijuana that is out today is very different than what was around in the 60s and 70s. And so what's happening is middle-aged people in Canada, since it's legal, are now starting to use medical marijuana or legalized marijuana, and they're going to the ER with a heart attack, and it's real, or a stroke, because now they have all these comorbidities and they're using a drug that's a much higher dose than it was 30, 40 years ago. So stroke and heart attack are real, and that anxiety and high pulse rate are also real. So what we do is we take all of the data and then we put it together in a letter form, give it back to our examiner, so that when we are ready, as the employer wants us to defend the fact that we shouldn't pay for it under workers' comp, then what we do is we present this, and instead of just saying to a judge, we are not going to pay for this because it's federally illegal, now we're using our clinical intelligence, all of the research, quoting the studies, and comparing it to the actual patient data, which helps us then determine what should and should not take place.
Yeah, and I know from a legal standpoint, because just looking at the legislation surrounding medical marijuana and the recreational use, and talking about the federal and the state interaction on it, I mean, I'm glad that we're doing those additional steps to make sure that we're walking in not just with one argument, but multiple arguments, if indeed it is inappropriate for the situation that is in the workers' compensation sphere. And just talking about the legal standpoint or the legislation or laws that surround it, we talked about the number of states that have legalized marijuana from a medical standpoint. We have to remember, number one, that it is still an illegal drug under the federal law. So we got under the Controlled Substance Act, it's a Schedule I drug that is illegal. Although we've had some federal indication that their classification of I'll call it the illegality of it, is lessening. So it's not something that, number one, they had the Cole memo back in 2013 that actually talked about the fact that they were not going to really try to enforce the marijuana laws. Knowledge that it was illegal, but it wasn't going to be something they were going to push from an enforcement standpoint. We've had the FDA recommend to the DEA that it be moved to a Schedule II drug, and that was as far back as 2016. And then recently we've had the Agriculture Improvement Act and the Safe Banking Act that has been proposed that actually start engaging some of the processes around marijuana and just how it's treated from a standpoint of federal law. But then you back up, so we've got the legalization of medical marijuana from the state standpoint, the vast majority of the states. Then the question drives down further is, how does it interact with the workers' compensation? Is it something that you are going to require carriers or payors to cover as part of the workers' compensation process? And that's where we're really, it's all over the board. I mean, you can look at
and it's hard too, right? Because once we start paying, how do we ever stop?
Exactly.
You know, with medical procedures, we have guidelines and there's clinical evidence, but with this, what would we do?
Exactly. And states are taking that exact approach. I mean, you have some states like Connecticut, Minnesota, New Mexico, New York that have said, okay, employers or carriers, you're going to have to reimburse for marijuana when it is prescribed in the workers' comp setting. On the other end of the spectrum, you have states like Florida and North Dakota who have actually passed legislation that said, no, it's not covered. We're not paying for it as part of the workers' compensation process. And then, of course, you've got to have some states that are trying to straddle the fence and stay in the middle. And they passed legislation like Louisiana did that, and I'm quoting, medical marijuana reimbursement is not required for workers' compensation. So basically, we don't know.
Passive aggressive.
Very aggressive stance. And then you have the courts getting engaged in it. Probably the most recent decision that I could recall was out of New Hampshire, And it was somewhat of a unique decision because the lower court had said you do not have to cover it under workers' compensation because of the fact that it's against federal law. The Supreme Court of New Hampshire remanded it to the lower court to say, well, you didn't explain what you meant by that clearly enough, so we're sending it back down to you to reevaluate your decision and look at the evidence again. Your interpretation from that could be that the New Jersey or the New Hampshire Supreme Court was saying, hey, you need to allow this as part of the workers' compensation process, but they weren't going to come out and say it. They just challenged the reasoning. So what you have is a situation where you actually have to look at the state-specific guidance. There's very little you can determine from the trends, and then we have to utilize things like what Dr. Bartlett was talking about as part of the review process to ensure that we've got all our ducks in a row as to how we're going to approach it. The last thing I wanted to talk about just briefly is just the impact to the employer. So I want to look at two specific areas, and that is obviously from a drug-free workplace standpoint and then employment decisions. And those are literally, they could be seen as one thing since they are very tied together. Again, just as with the engagement in workers' compensation from a payor standpoint, the states are very inconsistent as far as how they're approaching this. As already noted, under federal law, it is a Schedule I drug, and federal guidelines have come out and they actually promote employers having a drug-free workplace with their employees and may discipline employees who violate that policy. The descriptor they use to determine the violation is under the influence, and that's where you see states taking a different approach, is how do you define under the influence? First and foremost, it's tough to test as far as determining what level is applied to marijuana as, quote, making it under the influence and impacting your job and what you're trying to do.
Could I add to that a little?
Yes, please do.
So we know that marijuana hangs around in the body for at least 30 days. And if you're a regular user, probably longer. And as you so eloquently pointed out, Matt, a positive test doesn't mean that you're impaired. Because what we really need to understand is impairment. And under the law in most states, a DUI for marijuana is 5 nanograms. And there has been some breakthrough very recently, in fact, this year, in terms of breathalyzers that are about to come to market. And I know even the town that I live in, they'll do a saliva swab. If they feel you're impaired and they don't think it's alcohol, it can be opioids, it can be anything. They'll do that oral swab and take you in. And if you refuse, it's just like you're refusing a breathalyzer. But there are, I just wanted to mention in that, so there's a saliva drug test that's being used all over Europe, and it's called the Draeger drug test. And it's out there, it's been used, it does have false positives, so I think they need to improve on the technology. And then there's also breathalyzers, which are, one is called the Hounds Lab, and they're trying desperately to get that one to market this year. I haven't seen that it's made it yet, but it will detect for 2 to 3 hours after you use, it'll detect THC in the breath. And the other one is called cannabis. And it possibly, again, will come out this year. So we may have some breakthrough in terms of being able to determine if there's impairment, because it'll be able to determine the level at that moment, which would help employers, right?
Exactly.
You know, not only on the road, but it would help employers. I think the first one to come to market's a multi-million-dollar company, right?
Yeah, and that's a great point, because the objective is, what is impairment? And I want to talk about that just a little bit later, because, I mean, we all want to have a safe work environment for all of our employees. And as part of your drug testing policy, that will be some things you want to focus on. The one thing that is fairly concrete from a from the standpoint of how you approach people who test positive to marijuana is it's fairly well established in the states where it's legalized, especially from a recreational standpoint and also for a medical standpoint. If they test positive, then you cannot take affirmative employment action against them. Okay, in those states, they say that it's discrimination because of the fact that it's legal from a recreational or a medical standpoint. However, probably the most recent example of just a flip-flop from a federal standpoint is the way OSHA has approached it. Under the prior administration, OSHA had come out and they were actually pushing back on any employer doing drug testing post-accident. And the reason they were saying is it actually discouraged people from filing workers' compensation claims. Current administration, OSHA flipped on that and is now saying that no, you should be doing post-accident drug testing to promote a safe work environment for all of your employees. So you have a little bit of inconsistency there as testing becomes more prevalent and more accurate. It will help us from an impairment standpoint because the focus, once again, with any type of drug testing in employment is that you want a safe workplace for all of your employees. Just 5 quick points that the National Drug and Alcohol Screening Association has talked about with regard to that testing, how to make sure that you're put in the best position to prevail in any type of action that comes against you for the testing is to, number one, have a sound drug testing policy. Make sure that all employees are aware of the policy on a continual basis. Enforce the policy consistently. Have the drug testing program focus on 2 aspects. Number one, deter employee drug use while at work. And then number 2, workplace safety and performing work in a safe manner. So from a drug testing standpoint, those are kind of the 5 things to keep focused. And as we come out with more opportunities to approach impairment with a greater validity, then I think that it will help employers who are focused on that safe workplace. So that kind of wraps up what we wanted to cover this afternoon. I did want to kick it back to Dr. Bartlett for any final comments and just say we appreciate your time. Dr. Bartlett?
So I just have my favorite marijuana quote that I want to share with you. It goes like this: marijuana is a very dangerous drug. Some people have used it just once and ended up in politics.
Nice joke. Thank you.
Jonathan, did you have anything to add to us?
Well, as you can imagine, this is always a very topic that people are very interested in. Just a couple of questions now, and we'll try to collect others and follow up. But Dr. Bartlett, for you, you just talked about all the data we collect and the team that does that. Now, is this something that people can approach us about? How do they, is this a service that Sedgwick
It is a service, and actually through Max and mine intervention, through him being the chief claim officer, we have instructed all colleagues that if they get a request for marijuana, that they should send it through to this marijuana review box, because we want, even if it's a state where we have to pay, we still want the evidence of why it may or may not be a good idea. And so we are, that instruction went out early last year and has been in place. Clients may or may not know about it just because if they haven't had one on their files, but it's well worth the effort.
Great. And then Max, probably just one of these broad questions that you don't have the crystal ball, but you keep talking about questioning federal legislation. Do you anticipate maybe after the election cycle this year, what do you foresee coming up next year on a federal level? Does it just depend?
Well, there's a lot of discussion about it. Legalizing it across the country and taking away from its status as a Schedule I illegal substance. So it wouldn't surprise me if we see some form of legalization coming out at the federal level. I see Dr. Bartlett kind of nodding her head.
Well,
She may have an
it
opinion
depends
on
on
that.
who gets into the White House next, right? I think it really does. It's really a political issue.
Right. No, that's true. So a lot more things. We'll follow up. We may have a blog coming from you two or something else down the line. But thank you both for a great session, and as always, very informative.
Thank you, Jonathan.
Thank you.